What are some of the symptoms that might lead you as the clinician to really consider DNA adducts as a contributor to that patient in front of you? What conditions might DNA adducts be more commonly associated with? Or is this just something that every chronically ill person that comes into your office, that this is a key part of the exploration and the journey to getting them well?
That's an excellent question. I'm still figuring that out. But what I do know is everybody has adducts. It's just a matter of essentially how much chemical uptake you have that is interacting negatively with your genome. And then in relation to the work that needs to get done, so environmentally appropriate DNA expression, do you have enough reserve capacity to get the job done or not? So, for example, that looks different for a worker in a chemical factory where the detoxification enzyme system needs to be incredibly good, and you will have a dominance of expression of detoxification type gene regions, right? Now, if you decrease the appropriate and correct functional expression of those DNA gene regions by 30, 40, 60%, it may be below what the environment requires for you to not have a net tissue saturation versus the uptake is adequately compensated for. So to make a very complex thing short is, I think when you see in relation to people's genetic potential, if they were born healthy and they had a stretch of healthy life, normal health, and then they acquire a condition, that's where you definitely go look for it, especially if they've done the appropriate lifestyle adjustments. They've seen one, two, three, some of our patients have seen 50 doctors. And a reasonable amount of these physicians, I know them, and they do extraordinary good work. They're thorough. And that's when I know that there's something really important hindering the genome's ability to get the cell out of the CDR towards cellulogenesis. So I think it's when you see a discongruence between body behavior regulation and the actual symptom burden and level of health and vitality that someone has with what they're doing and what they've done. And of this, I'm certain that's when you absolutely need to go look for, at the DNA level, there may be a hindrance in the form of adducts.